Okay, guys, welcome. I want to welcome you to Project Touch Worldwide. We are discussing today DoTerra and healthcare, and we're doing this a little bit of a live session together with a video. So I'm going to actually show you some video. On the video, I can share my screen, and I'm going to show you some things that I would love to kind of share with you and see what is the trend in DoTerra. What are we going for? What is so different from what has been done before in DoTerra, and why am I so excited? Because to be honest, guys, I'm really excited about all the things that are happening within DoTerra. Hey, Shauna, good to see you, girl. Thanks for coming on. I'm so excited about what is going on in DoTerra in the next months and years ahead. And I want to share with you what that difference is and why I believe it will make a difference for all of us who are so much involved into DoTerra. And whether you're just starting out, whether you already have a team, whether you are sharing just a teensy little bit, or whether you're blown out and you're going for it full time, it doesn't really matter. There's some trends here that I really want to talk about. And for those of you who can't see what I'm showing for right now, and who can't see the actual slides, I promise you I will put them up so you can see them, okay? And you'll also have access to the video. But let's say hi for a little bit. Let's get into this groove, and let's say, for example, what is it that, think about for a second, what do you really want? What do you secretly hope is my question for a lot of people nowadays. What do you secretly hope to accomplish with DoTerra, with the essential oils, with Project Touch Worldwide, everything that we're doing? What do you secretly hope will be there for you? Okay, and that's something I really would love to put out for you, the question, and maybe get some feedback, maybe get some ideas. You can post it, you can think about it, you can write about it, whatever it is. I would love to hear from you. What is it that you really would love to get out of the essential oils, out of sharing the essential oils? Most of us who are right now in listening to this already love the essential oils. They love what they do for you, right? They love how they move you and how they change your physical and emotional health. But all have really thought about, what do you want long term? What is it that you desire from most of all long term from actually sharing these oils? Well, DoTerra had a vision. DoTerra had a vision 7 years ago. Hold on a second. Let me see for a second what's going on. Let me see. There's a couple of things that I'd love for you to see. There we go. Okay. Just want to share this screen with you guys for the people who are in there. Okay, there we go. So the couple of things that DoTerra really want. They wanted the world's highest grade, therapeutic grade essential oils. Okay, and they wanted to do that through to discover and develop that through a leveraged network of highly educated and experienced botanists, chemists, health scientists, and healthcare professionals. They've done that. Okay, they've been into that business. They have a team. They have a medical board. They've done that. Okay, second of all, they want to produce essential oil products to the highest standard of quality, purity, and safety. They've done that too. Okay, they've done that through third-party testing with Dr. Pappas. That contract is actually finished. That's not going anymore. So DoTerra is going to do that in-house again, but they again have multiple tests, right, to actually test these oils and really have the highest standard of purity and quality and safety. They also have the laboratory nowadays. They have lots of laboratory space in this new building that they have to actually do their own testing. So again, they've done that. They've also been able to do that. The third thing, they want to distribute the products through independent product consultants who, working from home, introduce and educate and sell DoTerra products locally through person-to-person contact, and also globally through the personalized web shopping sites. And again, that's something that has happened as well. And the last thing was then providing educational opportunities for all people interested in learning how therapeutic grade essential oils can be used as a self-care wellness alternative. They've done that as well, okay? Through all their summits, through all their, nowadays, their online workshops as well, they've been able to accomplish that as well. The last thing has not happened from their goals, from their original goals, and it is bringing together healthcare professionals of traditional and alternative medicine to encourage further study and applications of therapeutic grade essential oils in modern healthcare practices. That has happened to a small degree. Hey Megan, good to see you. But it hasn't happened to the degree that DoTerra has wanted to explore that. So this is coming, okay? Healthcare protocols are coming. Patient care protocols are coming to introduce these essentials into healthcare. And that is really exciting. Now, why is that so exciting to me? Well, there's a lot of problems that currently exist, right, in traditional healthcare. We have a very aging population. Over 1 in 10 people in the world will be over 65 by 2019. 1 in 10 people will be over 65 by 2019. That's a really, really big trend. Okay, and that brings a lot of problems in itself. Second of all, chronic diseases. We know obesity, we know cardiovascular diseases, hypertension, dementia. They're becoming persistent, widespread health problems, okay, and really in a challenging public health system. It's not working the way we have it right now. Drug prices. Between 2013 and 2014, these are still old numbers, but there were 222 drug groups increased price by 100% or more. I met somebody last week who's actually shopping in Canada for medications because it's so incredibly expensive. Personalized care is another one. Clinical offerings are shifting from mass to really having a customization there. Product safety is an issue because there's a lot of risk involved, and there's regulatory agencies are focusing on failures to disclose safety risks and concerns about the clinical trial process instead of having something already set up that it's like DoTerra has, where the safety is the concern of the company and basically does it from the start. That's not a big problem. And of course, government spending. I don't know if you guys know. What do you think? How much of the global healthcare spending is healthcare? What do you think? Give me an idea. If you can type it in, I would love to see it. What do you think? How much of global healthcare is spent of our global GDP? Any idea? Okay, I'm not seeing it. I'm going to tell you. It's 10%. 10%, okay? So large money goes into healthcare. Okay, so what does doTERRA want to do? doTERRA has 6 goals, and they're big ones, okay? And they want to do that in the next 10 years. A few trillion, yeah. Wow, I like that too. That's true, Megan. Okay, and we'll go into the numbers in a second. But the goal of doTERRA is to have exclusive access to essential oils telehealth support for loyal doTERRA customers. So they will have a support system in itself, in its place, for essential oils help. Okay, so it's not all just reliant on the wellness advocate, although certainly they will be involved, but there will also be a telehealth support structure in place. In 10 years, hospitals across America utilizing essential oils in research and patient care. Huge one, guys. Big, big, big one. Essential oils recommended by medical professionals through telemedicine. Do you hear the word tele here? Telemedicine, telehealth. That's something that's becoming extremely more important. Why? Because you can have, instead of having to go to your personal physician, which is also, it has its place, of course, I know, guys. But in terms of these specialized treatments, right, these specialized concerns, these specialized health concerns, especially with essential oils, more and more you see that people will work through the internet. Okay, even when I was working as a nurse in a hospital, we had people coming to Hopkins from all over the world. For some of them, that was very difficult. So guess what they did? I had a niece who was involved, who I got in contact with a physician here, who had a significant problem. And they took labs in the Netherlands and then sent it to Hopkins. Okay, so they could have that lab support. So more and more start believing that telehealth and telemedicine is actually becoming really important. Okay, so again, oh my kid, I good to see you there. So again, doTERRA has the goal of having telehealth and telemedicine as a goal in the next 10 years to have essential oils available for people that way. So hospitals will recommend it, healthcare professionals will recommend it, and they also have a goal that doctors and clinics across America recommend doTERRA essential oils to their patients. Okay, the 5th one, essential oils purchases will be an authorized medical cost for health insurances. That'll be a big one. And essential oils in every home in America continues to be a goal. So doTERRA has many, many goals here, as you can see, to promote essential oils in the home, but also within healthcare institutions and through telehealth. Now, I want us to, as a group, to start thinking about that, because we are Project Touch Worldwide. We believe that the touch of essential oils can change people worldwide. I want you to feel that goal. I want you to, we just have it represented in a website, projecttouchworldwide.com. Please share it. We'd love to have as many people participate on that. What you need to have in place is really work and get your $50 bonus in place. And you need to know aroma touch. You don't have to be certified, but you need to know touch. You need to love that touch and be committed to the business piece. That's when you can have a little, you can have a spot on that website. And I would love for you to participate in it, to do interviews, to be part of this movement towards Project Touch Worldwide, because it's a big one, guys. And I love the website we have. It's beautiful, it's gorgeous, and we can make a difference. Now, how does that work? How, if you look at those 6 goals that our DoTerra is going for in the next 10 years, how can we participate in that? I would love to have the discussion about that. If you have some ideas, write it down. Also on Tuesday, we'll talk more about it, but how can you be part of that? How can Project Touch Worldwide be part of these goals? Okay, let's start thinking about that. And I don't believe we only have to be healthcare professionals to do that. Okay, I think DoTerra has a wider view, and I definitely have a wider view than that. I believe in doctors and clinics, of course, recommending it, but I think we can be part of that. And I'm already in touch with, I run a medical center. I know some people are in touch with hospice, not much related to me. Megan already has some places where she's in touch with, institution as well. So there are organizations we can be in touch with to do that. Okay, before I go on, let me just go on and say this a little bit. I want to put some numbers in there. Okay, because I really believe we're at the cusp of something big in DoTerra, and we can be part of it. And guess what? If you're part of it, you're also going to have the income that's part of it, and you're going to have the freedom to be part of that. Okay, so feel it. I feel like there's a switch, there's a turn coming, and it's the right time for us to be involved in this. It's the right time to actually connect with this vision that's new, and that we are also part of. Okay, and you can be part of that. When I went into an assisted living, she wanted me to be part of a happy hour for professionals who and marketing people who would refer residents to their place, to their assisted living. That's what she was wondering if I would be able to do that. Okay, so again, you don't have to be a medical professional to do that. Okay, I could be anybody. I don't have to be a medical professional. You just have to be confident. You have to be confident. You have to know that you can make a difference there. Okay, so I have a slide here about direct sales in the United States. 36 billion in 2015 was the direct sales in the United States. Okay, Amway, Avon, Mary Kay, Herbalife, Melaleuca are all big companies in there. DoTerra has not disclosed the 2016 sales. I think it's anywhere between, it's over 2 billion at this point. We do know it's over 2 billion. Okay, so Amway, for example, is 1.1 billion. Avon is 0.95, Mary Kay 0.9, Herbalife 0.86, and Melaleuca 0.75. Okay, those are all essential oils companies. Now, if you look globally, the direct sales globally is about 184 billion in 2015. And there are some other ones that I don't even know in there. But again, there are some big companies like Amway was 9.5 billion globally. Herbalife was 4.47 billion. Ambit Energy is a different one, but that's 1.4 billion. So there's some numbers there for you. It's about 1 to 2 billion. Okay, but this is the one I'm really excited about. If you look at a whole entire direct selling company, okay, we talked about 36 billion. Now, Megan was right when she mentioned how much the healthcare industry is. Healthcare industry right now is 1.7 trillion. Okay, so all the direct marketing companies in the United States together had 36 billion, but Johnson & Johnson already is 70 billion. Humana is 42 billion. McKesson, which I don't even know who they are, is 180 billion. Okay, so Pfizer is 49 billion. That's about the approximate size. So 1.7 trillion is the current size. Well, the way we're growing, it is predicted that in DoTerra, in the United States, right now it's 1.7 trillion. That healthcare industry will grow to 3.0 trillion. Okay, right now, DoTerra is about 2 billion in there. in 10 years, they want to be at least 20 to 30 billion in there. Okay, that's huge. We have above 600 wellness advocates that are diamond and above. Not that many. Okay, 600 above is not that many. Well, guess what? If you want to go from 2 billion to 20 to 30 billion, you need a boatload more of diamonds. You really do. And so here's my invitation to you to again be part of this. Know these numbers. As you talk to people, know that doTerra in less than 10 years, I think we're 9 years in existence now, actually has grown to a 2 billion company. Okay, a very reliable 2 billion company with no debt. And that the intention is to grow in the next 10 years to about 20 to 30 billion, to be part of this 3.0 trillion industry. Okay, so what's in place right now to currently do that? Well, of course, it's the whole army of wellness advocates, but there's also 117 partnerships with top researchers, medical professionals, hospitals, and universities, including Johns Hopkins, which to me is very exciting. There is a team of 30 plus in-house scientists. They have an expert medical and scientific advisory boards, and they have 2,200 square feet of cutting-edge laboratory space. And there's always the relentless commitment to quality to ensure safe and consistent clinical usage. Okay, so what does that mean for our team? What can we do with that? I think we already touched a little bit about it. To me, Project Touch Worldwide is definitely a part of that. Okay, and we're not just going to do healthcare. I want to get that idea out of the way too. I want you to know these numbers so you know where the growth is going to be and where you can be part of the growth as well if that's something you choose to do. Okay, where you can be part of it all. Continue to do with one-on-ones with your family members, with your friends, with people all around you. Continue to do that. But also don't neglect the trend that is online, for one. So keep it close with your direct market. Do things online as well. And then, of course, also move into this bigger healthcare industry. Okay. Now, I want to talk more. I want a conversation going about how you can do that and how you can most optimally do that. I think we have had some experience, some good, some bad, but we had some experience in the last 2 years on doing that and going into healthcare organizations and talking with them and what they need. If you are doing it, in general, I would say be very open to what they need. What is the gap? What is the problem that they're having? Now, that may be healthcare organization, that could be a spa, that could be a massage place, that could be any kind of business. It could be a regular business. Guys, we're looking at going to NASA in September, which I'm really excited about. So you can approach a lot of businesses and see what is their gap, right? For a lot of businesses, it may be that there's enormous stress going on for people and they want that relieved. They may have a lot of people going out because of all the flu symptoms and all the stuff that we're having. They may have a lot of people having pain problems in their back, because back is a huge issue. Well, you may be able to give something like that. You can all do that. You can actually suggest that, hey, could I come by and show you that? Send some emails, connect with your network. See if people around you know anybody who has a business, for example, or is connected to a business and could actually do that. Okay, be a little bit broad in your thinking. I want to broaden our thinking and what is possible for us to do and who we can connect with. We have the knowledge, we have the handouts, we have the platforms, we have the support for you to connect with businesses, with organizations, and to go and move things there. In addition, always in addition to your own friends and family and your close network, because that's always still there. It's got to still be there, okay? Always your close network too, and your online network, but also look a little bit further and then decide what is it specifically that you want to focus on. My focus has always been anxiety and stress and belief systems. That's always been one of my focuses. But in terms of the oils, it's always been really increasing your energy and really allowing yourself to let go of some of the stress around you. But there's many other things. There's many other things we can focus on. That's not the only thing I teach about, but that's one of the things I teach about. So I guess to sum it up is don't be afraid to go into organizations and then see what they need. Okay? When I went to the hospital, it was very clearly that they had a lot of clients who know about these oils, and the healthcare professionals are not always buying into them. But there's a lot of patients who want them. There's a lot of patients who want more information about them. So that was the gap. That was the gap that we look at. Look at what the gap, look at where they are and what they want, and how you can then step in and provide that. And be strong in where you stand up. Okay, nowadays I stand really strong and I say it's got to be worth it for me. If I spend my precious time doing this, then I would love for, and that's the same thing as you guys listening to me right now. I don't want to waste any time anymore. So I hope this is not, if you ever are on a call with me and you find it's not serving you, hang up. Okay? I don't want you to, I don't want you to be here if this is not valuable to you. You can also send me a message and say, hey, I need to hear something else. Or you send me a question and they redirect me that way. But I want you to consider your time as valuable, as very valuable. Because when you see your time as valuable, everybody else will see your time as valuable as well. Okay? It's the same reason why I'm recording this twice right now. Because I consider my time to be valuable. And I want you guys to get the most out of it, but I want to do it in different platforms. So you can hear it, and it can also be recorded. So we can actually make a difference there. Okay? Okay, that's all I think I want to say. I want to encourage you to invite your team members to come on Tuesday. We're going to talk more about the compensation plan and how all of this fits into the compensation plan. Because that's ultimately your bottom line, right? It's nice to have these dreams, and it's awesome to have these dreams, and you got to have these visions about where you're going to go. But there's a bottom line too, is when is it going to bring me money, and how is it going to bring me money? So I'm not going to talk about that today. I'm going to talk more on Tuesday. So invite your people on Tuesday. Okay? Love to hear some comments on this video. Love to hear some of more information about this, so you can actually know more about. So I can answer more questions about specific things you have about everything that I just shared today. Okay, thanks so much for being with me on this call. It's been wonderful to see everybody. And like I said, let's start sharing this call with your team members so we can have people come on Tuesday at 7:30 p.m. as well. 7 p.m. for our regular call, and on Tuesday it's at 7:30 p.m. for this business call. And in the meantime, 6 a.m. calls, they're still where it's at. Okay, love you guys, and talk soon. Bye.